These are hard times right now. But I can tell you, to be in a medical field in general, to be able to help people is an amazing thing. When you go through and become a physician, and especially an osteopathic physician, you learn to look at problems in the whole picture, in the whole realm of how it affects the person's ability to live, to perform their activities of daily living, their happiness, their spiritual health, not only their physical health, what you might just think that a traditional doctor might be invested in. So when I was looking at becoming a physician, I knew I was interested in science, right? And I knew that I wanted to work with people and I wanted to help people. And I also knew that factors that prevented disease would be important. And with my background in nutrition, I was really interested in looking for opportunities that would enable me to apply my understanding of nutrition and health and how it related to the overall health and wellness of my patients. And what was really exciting is that the osteopathic philosophy allowed for that. When you look at the whole person and you address all the factors that can be important to their health, nutrition is a big piece of that. And I love to eat. I love nutrition. I've loved food since the time I was born. So it just was a natural fit for me. EOs are licensed physicians that can prescribe medications and perform surgeries. Osteopathic schools have the same 4-year training during the pre-doctoral years as allopathic schools. We take a whole person approach to care. Our treatments take into account all aspects of what make our mind and our body healthy in order to heal. Osteopathic principles are the principles that the mind and the body and the spirit are interrelated. This is a philosophy first started by Andrew Taylor Still in the 1800s. He believed that the body and the mind and the spirit together created a unit, and that was the first of the 4 principles. The second principle is that the body is able to self-regulate and self-heal in order to maintain. And the third principle is that the structure and the function of the body are interrelated. And the last principle is that treatment should therefore be dictated by the understanding of how the body unit is related to its structure and its function. Osteopathic training emphasizes the whole person. The emphasis of the treatment is going to be on prevention and focus on the person and not the problem. You are in a great spot. Kansas City University is the 8th largest medical school in the United States. Our campus has locations in both Kansas City and in Joplin, Missouri. This can make Kansas City University available to not only urban settings, but also in the rural settings, and more students can apply than before. Opportunities to gain early clinical experience through our programs such as Score One, also global medicine and mission trips can focus on the communities that we serve. KCU is an exciting place to be because we have an innovative curriculum that develops clinical decision-making, and we help students develop skills to use an integrated, patient-centered approach. There in our university is a full network of student support through peers, faculty, staff, and our student services to support student endeavors. Kansas City University has new developments in virtual reality and artificial reality that give our students advanced simulated training experience and clinical opportunities, especially with the new opening of our Center for Medical Education Innovation. The interconnectedness between being a physician and being able to serve people is a privilege. You have the ability to share that journey with your patients. And I can tell you that your soul and your spirit is certainly enriched with every patient that you care for. The exciting thing is that medicine is a team sport and we work together. We work with nurses and technicians and mental health specialists, all these people to help care for patients. Medicine is a great field.